As many of you know, I'm a board-certified OB/GYN doctor, and I've been in the practice of medicine for many years. The main advantage of that kind of medical longevity is that you can have a perspective that only comes from seeing things come and go over time. I've been around long enough to have seen several medical practices be touted as absolutely necessary, then fall out of favor, only to come back in vogue at a later date. And so it is with hormone replacement therapy. Prior to the findings of the Women's Health Initiative study, which was begun in the 1990s and first published in 2002, hormone replacement therapy for women was just a given. Everyone knew that as women aged, the function of their ovaries decreased and then stopped, and that it was best for their overall health, and quite frankly, for the overall health of all those around them, that they should be put on hormone replacement therapy. And you were considered a bad doctor if you did not do it. But the findings of the WHI study showed that, to our great surprise, hormone replacement may cause an increased risk in breast cancer. And shortly after that, very shortly, nobody was prescribing hormone replacement therapy anymore. It was basically essentially eliminated for women, and they were told essentially there was nothing we could do. There were some alternative synthetic drugs that were offered, but they never functioned quite as well as the hormonal therapy, and they had their own set of known risks, some of which can be downright scary. As for the aging male, well, forget about it. We were told testosterone causes prostate cancer, end of subject, don't talk to us anymore. So men were never given any option other than to just accept the consequences of aging and told don't complain, so we didn't. So now we all know that as the consequences of aging with no hormone replacement is that grandma begins to look like grandpa, and grandpa starts to look a lot like grandma. In 2007, I became interested in the practice of aesthetic medicine and spent a great deal of time going to conferences and training programs and began to incorporate advanced aesthetic procedures into my clinical practice. It was during this time that I became more interested in the concept of anti-aging, especially since much of aesthetics is a procedural type of anti-aging. Now, coincidentally, at about the same time, I started to have patients coming to me and asking questions about hormone replacement and this thing called bioidentical hormones, and asking what I thought about what Suzanne Summers was saying on all of the different talk shows. And I honestly could not give them a reasoned, medically based answer. And it really bothered me because I'm supposed to be the expert at hormone replacement, and I couldn't answer any of these questions. So I began to do research, and I decided that it was an area that I needed to at least get some advanced training in. And so I enrolled in what I think is the premier training program in bioidentical hormone replacement therapy in America right now, which is the American Academy of Anti-Aging and Regenerative Medicine, which is affiliated with the Florida State Medical School campus. As a result of my training, I learned new ways to approach patient care. I learned that anti-aging really boils down to prevention versus treatment. I learned that the findings of the WHI study were not surprising at all, based on the medications they were using and how they were being prescribed. At that time, no one's hormone levels were ever measured to see if the doses and the types of hormones that were being prescribed were the right ones, or if the doses they were given were sufficient, too much, too little, or if adjustments were needed. None of that happened. In essence, no allowance for individual need was made. It was a one-dose-fits-all kind of program. We now know that hormones in the human body behave much like a symphony, a very intricate symphony. And they have a web of interactions in which one affects another. The pathways in which hormones in the human body are made interact with one another on how they're metabolized and excreted. These issues were completely ignored. Most of the people in that study used an estrogen derived from horse urine. It did not fit in their intended receptors very well. They fell off very easily, and they didn't function very well. The big problem was when these hormones these artificial hormones were given and they fell off the receptors, the body did not recognize them. It did not have a pathway for degrading these synthetic hormones. So it was a very slow process of removing these from the body. So these hormones would float around inside the body for many weeks, and nobody knew what they were doing. Nobody ever measured the levels of the hormones or their degradation products. And they didn't know how they were affecting the hormonal cascade, that intricate web of interconnections within the body. Now, if all that was not bad enough, it also did not take into account that the hormonal milieu of the body needs to be balanced. For instance, the human body makes 9 different estrogens, some of which are found to have more carcinogenic tendencies than others, and some that are protective. Some receptor sites in the breast, when activated, mainly stimulate tissue growth, while others stimulate tissue maturity and stability, and are therefore more protective against breast cancer. So prescribing just one type of, even prescribing just one type of estrogen without taking that into account, which is stimulatory to the breast, even in low doses, without balancing it with a protective type of estrogen, could turn out to be harmful to the patient. So now you can see an appropriate hormone replacement therapy program must take all of this into account. Even the route of administration, either by mouth or by using a cream, can have a significant effects on the outcome and risks of hormone therapy. Now let's look at bioidentical hormones and how different they are. Now, bioidentical hormones are the exact same chemical structure of the hormones that your body makes. So they fit into the receptor site very well, and they have a more normal, appropriate response. When they're done doing what they needed to do and they fall off the receptor, your body immediately recognizes it. Oh, there's an estrogen molecule. It's floating around out here, shouldn't be floating out here, let's get rid of it. And so it has a process for degrading these chemicals immediately. That is entirely different than using synthetic hormones. For men, we now know that the connection of testosterone replacement and prostate cancer was based on an anecdotal experience of a famous urologist with a single patient 50 years ago. Since that time, there have been multiple studies that show that testosterone therapy does not cause an increased risk in prostate cancer. Now still, testosterone therapy does have potential risks, and again, sound medical practice with continued monitoring of doses and levels must be performed to safely prescribe treatment for men as well as women. That is why now, knowing what I know, I will only prescribe bioidentical hormone replacement therapy via prescribed treatment plan that monitors and adjusts the therapy according to sound medical practice. Now, having said all of that, it's important to understand that the use of hormone replacement therapy does not stop us from aging, unfortunately. But it can provide us with improved vitality, improved awareness, improved mobility, and a more youthful appearance as we age. That's a pretty good return. We know that of the more than 400 functions of estrogen in the human body, a significant one is its effect on the skin. Together, estrogen and testosterone help to provide a more youthful appearance to the skin by increasing structural support, by decreasing sagging of the skin, and by decreasing wrinkles. And therefore, they are an essential component in maintaining a youthful appearance to the skin. It appears that they may accomplish many of these effects through their known activation and regulation of the body's own stem cells and their processes. especially those that are located within the skin itself. Stem cells are specialized cells that are located throughout the body that have the ability to influence surrounding cells and even to become other cell types themselves. During my training at A4M, I had a brief introduction to stem cells and their possible use in treating disease. And about 3 years ago, I became very interested in the whole concept of stem cell therapy. And after some additional training with one of America's top stem cell researchers, Kristen Kamela, I began to offer my patients stem cell therapy for some chronic conditions. We do this via IRBs, or institutional research protocols.